Ebola is one of the latest outbreaks of what we've experienced here in the United States. There is a true issue in regards to the deadly outbreak due to the fact that there is no true cure for this. The virus can and has spread from West Africa to various parts of the United States. Emergency medical services person, as well as healthcare professionals, should be aware of some of the signs and symptoms that people include. Signs and symptoms that may appear anywhere from 2 to 21 days after exposure to the Ebola virus. On an average, it's approximately 8 to 10 days that the symptoms are going to appear, and some of the symptoms for the people that are impacted by Ebola will include fever, severe headache, muscle pain, weakness, fatigue, diarrhea, vomiting, abdominal pain, and other acute unexplained hemorrhages that may be causing bruising. As far as recovery time for patients regarding Ebola, it depends on the supportive clinic as well as the person's immune system for people to recover from Ebola. Ebola may last within the body for approximately a period of 10 years. Currently, one of the largest outbreaks in history is now affecting multiple countries in West Africa. A small number of cases have been reported as well in other areas, such as Senegal, as well as Nigeria. However, these cases are considered to be contained and not further spread to any other countries as far as the CDC has mentioned. The U.S. has partnered alongside the CDC and also working alongside the World Health Organization in order to assist international healthcare organizations to ensure that the deadly virus is not going to be spread any further. Unfortunately, the natural reservoir for the Ebola virus has not been found yet, and this virus first appears, so is believed by scientists, that a person who is coming in contact with animals, such as apes or monkeys, may be at greater risk for contacting Ebola. When the infections occur in humans, the virus can be spread to others, though either through direct contact, for example, broken skin or mucous membranes, through the eyes, the nose, and the mouth. The Ebola in general is not spread through the air or water, or in general by food. On the other hand, in West Africa, where there is a high rate of Ebola due to the fact of handling of wild animals that have been hunted for food, this is soon becoming an epidemic proportion in this area. One of the things to remember is that research is indicating that there is limited evidence that mosquitoes or other insects can transmit Ebola to other people. Healthcare providers who are coming in contact with patients who have Ebola need to understand that this deadly virus can spread quickly. People who are patients and healthcare workers are exactly at the highest risks of getting sick because they are coming in contact with infected blood as well as fluids from others who may already been infected with the virus. Exposures to Ebola can also occur within the hospital setting. The healthcare settings where personnel are continually in contact with Ebola patients need to be properly protected. In this case, dedicated medical equipment, preferably the type that can be disposed of, should be used by healthcare personnel and providing care for those patients who are infected with the Ebola virus. Much as in a normal strand of viruses, Proper cleaning and disposal of instruments, such as needles and syringes, are important to dispose of properly. So this way they are not able to come in contact with those patients nearby, as well as healthcare workers who have already used those needles. Without the proper sterilization of instruments, the virus is said to be able to be transmitted and continue to do so and amplify into a complete outbreak within a particular region. The good news is that once people recover from Ebola, they are no longer susceptible to spreading the virus to others within the community. Although the Ebola virus has also been found within minutes after a patient says he has recovered, it is not known whether or not the virus can be spread through sexual contact. Healthcare providers securing for patients and family members are at greater risk to come in close contact. Some of the risk factors that are included in regards to contacting Ebola include the following areas: high-risk exposure areas such as a needle stick and exposure to blood or bodily fluids, direct contact with a dead body without proper sanitary conditions, or living within the immediate household area and care being provided to a person who has been infected with the Ebola virus. Other epidemiological risk factors that should be taken into consideration and pose some risk are many of the following: direct contact with a person having Ebola, and then coming in direct contact with any bodily fluids directly related to patient care in the healthcare setting. Proper PPE is suggested to be used as far as gloves, goggles, gown, and masks. There is a low risk in contacting Ebola when a person is not wearing PPE and the infected person is that in the incubation stages of Ebola. And finally, having been in a country with Ebola cases, but without the actual widespread transmission or cases that are being established with uncertain areas and not being able to be contained. In an effort to combat an Ebola outbreak, careful hygiene must be practiced simply by washing hands with soap and water, or the use of alcohol-based hand sanitizers, and avoiding contact with any bodily fluids is suggested. Not handling any items that have come in contact with an infected person's blood or bodily fluids is also suggested for healthcare workers. The avoidance of a funeral, burial, or a funeral ground where someone has died from Ebola is one of the other precautionary measures that should be taken and considered should you be traveling to an area that has been impacted by Ebola. A lot of Ebola patients, if treated, it is not possible to return to the United States for monitoring during 21 days at least, and then seeking medical attention for any symptoms of this, as it is so highly suggested in the current state. Any healthcare worker that may be exposed to people with Ebola should be wearing the appropriate personal protective equipment, practice infection control and sterilization measures, isolate patients from other patients, and then avoid direct and unprotected contact with any of the patients who may have Ebola. And finally, notification of health officials if there has been direct contact with either blood or bodily fluids. Then the virus will be known to enter the body through broken skin or unprotected areas on the body, such as the eyes the nose, and the mouth. On a positive note, the likelihood of contracting Ebola is in the United States is pretty low, unless the person / healthcare worker has come in contact with the blood or bodily fluids from a person who has been infected with Ebola. It has been showing signs and symptoms early in such a similar manner to those seen with either febrile illnesses, but also within the emergency medical services, the providers should understand that the signs and symptoms that begin with Ebola may be similar to those with flu-like symptoms. Although it is a greater risk within the hospital setting for the Ebola virus transmission to healthcare personnel, the actual transmission to EMS personnel in the field also present some unique challenges due to the fact of the uncontrolled nature of the work environment as well as the work field that has been showing up in these designated areas. Potential for resuscitation procedures may be needed, and the patient is within a confined space within the ambulance. These are two areas where the emergency personnel worker may become exposed to Ebola. The EMS system provides the need to be trained and educated prior to handling any patients that may be infected with the Ebola virus. Proper PPE, as well as other established protocols, need to be implemented, and it may be necessary to decontaminate and sterilize the entire ambulance as well as other instruments that are contained inside the vehicle prior to going back into service. In order to perform emergency runs, there also needs to be the understanding that the emergency personnel also need to be checked to ensure they have not been exposed to Ebola. There needs to be a concerted effort with both medical service providers, the healthcare facility, and in some instances the medical director within that healthcare facility, and joining with the community to create a comprehensive plan and formalizing a comprehensible plan for Ebola. There may be situations where the patient has been carried by multiple providers and required to put on PPE. The providers that are wearing PPE, who have to care for the patient with Ebola, must remain in the back of the ambulance and should not serve as being the designated driver going to the facility. It also should be noted that the ambulance personnel who are coming in contact with Ebola patients or suspected Ebola patients should immediately get in touch with the healthcare receiving facility in order to let them know there's a possibility in transporting a patient with Ebola. Thus, the healthcare facility can prepare with proper PPE, isolation, and alerting the CDC perhaps in regards to the patient that they will be receiving based on the circumstances for Ebola. And based on the circumstances, it is imperative that coordination, communication, and working alongside other agencies within the community occurs, much like in disaster, terrorism, or other public health issue events that may arrive. Depending on the type of outbreak, in order to create an incident command post and a unified command system, it might take much work in order to make it function throughout the contamination from Ebola.